Good evening, ladies and gentlemen, and welcome to another episode of America in Black and White. Tonight, we have a guest that's going to be visiting us from Nigeria. His name is Ugo Nnamdi. Ugo is still trying to log on. In the meantime, what I will tell you guys is he's here to speak about the HIV infections and how things are taken care of and handled over in Africa. What's the status of many people? What's the statistical trend at this point in time? This is a reminder of how things should always be. So I'll tell you all tonight. Our podcast. We delve into the important issues affecting minority communities in the United States as well as abroad. Today we have a special guest with us, Ugo Nnamdi, an expert in HIV testing, treatment, prevention, and the stigma surrounding HIV. Let me tell you guys a little bit something about Ugo. He has a strong advocacy and passion for equals, a successful treatment outcome that an undetectable viral load is sexually untransmittable has seen many people living with HIV. That is to start and restart or continue antiretroviral therapy and achieve optimal positive living and loving. He is a strong believer that quality health services are the right of all persons, irrespective of sex, gender, or sexual orientation. He has more than a decade of work in the HIV program, and years of experience and training have been positively used to impact the lives, ensuring that they're linked to and are retained in care. Ladies and gentlemen, I'd like to introduce you all to Ugo Nnamdi. Welcome to the show, Ugo.
Thank you, Charles. Good to have you.
So, in doing your bio, is there anything else you'd like for our audience to know that I did not mention?
Quite frankly, you've captured everything basically. But I would also like to add that for anybody living with HIV, there is no fear any longer because the treatment works. And we are now in the era that undetectable viral load is equally sexually untransmittable. And that is the message everybody should carry on with and live his or her life without fear of being at risk of infecting a sexual partner or living a longer, healthier life. There's nothing to worry about. And uh, it has been my passion, it has been my goal to um, ensure that everybody gets this message and live with it. There's nothing to worry about.
So let's start with this first, because what's the most interesting and intriguing thing about this virus, and we know that it's global. But can you tell us, for your country there in Africa, in Nigeria, what is the situation of HIV? What is its status? What is its trends? How is that? How is that looking? How is that working?
Okay, in Nigeria, like every other developing countries in Africa, the trend is still high because you see persons who are afraid to come in to have themselves checked, test for HIV, and those who already know their HIV status are afraid again to come into the clinic for treatment, for many obvious reasons, including stigma and fear of being seen or being known. So, because people are afraid to come out to test, because people are afraid to come out to treat, and even people are afraid, of course, if it's when you know your HIV status that you talk about either treatment or prevention. People are afraid to come access PrEP for prevention of HIV. You see, we now continue to have new cases of infection. So it's high, especially among same-sex lovers, because of many exposure to that. So Nigeria is not different from every other African countries or where HIV is ravaging. And
Well,
is our hope that the fear will be removed, the stigma will be, really, really tackled, that people can be able to boldly come to test and treat and equally live a healthier life.
Well, I think that's a global thing because there's a lot of that also happens here in America, where there's a lot of people that don't want to get tested, or those that get tested, they never tell people their status. And so
Exactly.
sometimes, if they're undetectable, we know that means that you can spread or transmit this disease.
Yeah.
So, people are afraid of the stigma, and they just really
It
do not want people
is
to
in human
know
nature.
about their lives. But I think it's always best because as you mentioned earlier, I think the true thing is, if you do know your status, especially early, that you can actually start treatments to where you can get to that undetectable status and not have to worry.
Exactly.
So
Exactly.
let's jump right into the this discussion about the testing. Can you start by telling us about the importance of HIV testing and why everyone should be tested?
Okay. I lost you at some point, but if I got your question correctly, you're talking about why is it important to know your HIV status?
Yes, why testing is so important, why everyone should be tested.
Because HIV can happen to anybody. Gone are the days we are categorizing HIV infection for a group of people, or it can happen to this person because of the kind of life he or she lives. No, it can happen to either white, black, it can happen to anybody, right? So it's
Mhm.
important that everybody just check. You must not be sexually active. You must not have multiple sexual partners, just one. Once you've ever had sex, you know, and you don't know the HIV status of your partner, it's very important that you walk into a clinic and get tested. And this day we have self-test kits. You can test yourself in the comfort of your room. Just get it. It's self-explanatory. You can use it anywhere. Get your self-test. It's very important because when we get to know on time, we
Mhm.
treat on time,
Mhm.
and we get suppressed on time, we get undetectable on time, and we cannot sexually transmit as well. So the fear of I don't want to know, in Nigerian terms, you hear it is better I don't know than that I know. You know, what you don't know will not kill you, but that's not the that's not the issue. It's better you know on time, get tested, you know, get treated on time, and you live longer like every other person, live normal like every other person, as if there's no HIV. But fear does a whole lot of things, it limits somebody from progressing. So the benefits of HIV can is immeasurable. Is immeasurable in this age and time that the testing is the result comes out within minutes. Within 15 minutes, you know your result, and you can be able to determine whether you're treating or you're preventing. And it's very, very important. And I encourage anybody who is still not seeing the fear of walking into a clinic or getting the self-test kit. I just want to encourage whoever that is listening and said it's better you know, and you know on time, and you take control, be in charge on time.
So can you tell me this? Is it in Nigeria? Is it the same as here in America, where you have these guys that they call on the down low or the DL? That these guys are just as much represented in your country, where they're having sex with both men and women and they're spreading the disease.
Oh, well, yes, like every other country, right? Is there, you know. Um, I am of the opinion that HIV, of course, HIV is not only for gay men and women. HIV is for both heterosexual and homosexuals. So whether you're having sex only with me women or you're having sex with both men and female, so is applicable everywhere, and it happens here too. And that's why when you are to get tested or get treated, these things are not really of much concern, provided that you're a human being, you'll be attended to as a human being. And nobody goes to, for example, you walk into a bank and you'll be asked about your sexuality. Are you gay or are you straight? Or you walk into a fuel station, they will be asking you about your sexuality. No, the hospital or facility clinics are also like that. Just walk in, provided you are there for medical attention, medical assistance, you'll be attended to. So it's everywhere, both in Nigeria.
Yeah, and so just to clarify, so I can make sure that the premise of my question was is that I understand that it doesn't matter if you're gay, straight, black, white, whatever you are, that the disease is out there. What I'm stating is that, and I guess maybe I should have phrased this a little different, is that those particular guys that are sleeping around like that on the secret are the ones that are primarily the ones that are more prone to have this virus but not know that they have it. That was my premise.
Yes, it's possible. It's possible. There's no way you will know without testing. There's no way you will know without testing. And you have multiple sexual partners, and you're, of course, you're, because of your sexual orientation, you're hiding and having sex. There's chances that this HIV will keep spreading. So it's also applicable here in Nigeria.
So tell our audience this. What are some of the common misconceptions about HIV testing that you often encounter?
Okay. In Nigeria, especially in our clinic, when you walk in, you hear some persons saying that like, God forbid, it's not my portion, right? Is an attack. I dreamt about it. I met a man few days ago who walked in, and I would like to know your history. So by the time we got talking, he was telling me that he dreamt, and in the dream something 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 happened and all that. Yeah, I might not totally agree with all that, but I will not also rule out their reality. So you have the myth and misconception that HIV affects people who are promiscuous, who are careless, who have multiple sexual partners, who are not careful, in choosing their sexual partners. So these myths and misconceptions are what keep people away from testing. And when the result comes out, you see that self-denial, you see that delay in starting treatment. Someone will be asking you, how will I, when I don't sleep around? Somebody used the word dirty. I am not a dirty person. I said, who is dirty? Right? So these are misinformation you have out there. But again, for me to convince you that this is your result after the test, is I have to take you through. What we do in our facility is to take you through the process of testing, explain what the outcome will look like. Okay, you see this and you will not see that and all that. So by the time that appears, and we just ask you, okay, what do you think is the result and all that. So it's there, but we are overcoming it as they appear, as they appear.
Well, thank you for clarifying that. Moving on to the HIV treatment, can you explain the advancements that have been made in HIV treatment in recent years?
Oh, this is beautiful. um I'll first of all say that science has been advancing. HIV treatment have really, really, really changed in recent times. Before now, we had pill body. You see someone taking up to 15 pills, 20 pills, 5 pills a day. But now we have only one pill, 3 in 1, mostly in combination. So we've moved from pill body to just one pill a day, and you go about your business for the day. Apart from that, HIV treatment has become more um, friendly. The treatment we had few years back, the drugs we have few years back was of trouble. You see, when you take it, you have a lot of trouble. For example, you take it at night, and throughout the night, you have your troubles, and in the day, you try to get yourself again in the night, you take the same pill, and you keep battling that and that. But now, the pill the treatment we have is very friendly. Most times, you take it in an empty stomach, and you will not even know that you're taking your pills. And one of my friends, someone on treatment, told me when she came in contact with the new treatment, she was like, "Where did you keep this all this while?" And I was just smiling. So it has been with the pill burden have greatly, greatly reduced. It's more friendly. You can take it in an empty stomach. You will not even know that you're taking a pill every day. And the drug interaction is no longer there, right? You see some persons who are diabetic, who are hypertensive, and also living with HIV, and they have to treat all these things every day. So they are free to take their pills, whichever one you're treating. If you have other morbidities, the, there is no drug interaction, and easier to take and easier to remember, and all that. We've made significant progress, and I'm deeply, deeply grateful to science and every other person behind that.
Well, that's incredible progress, and I hope people are listening because that's coming a long ways.
Yeah.
Um, what are some of the challenges that people living with HIV may face when it comes to accessing treatment?
Oh, I think these have to do with maybe locality or facility, country by country. But using Nigeria as an example, we humans are different. You see some attitude of healthcare providers, maybe try to, in order to do their job, you try to make the other person uncomfortable. There might be some use of words that might hurt. That's why we are trying to use words that are not stigmatizing. We try to use, instead of saying positive person, we say persons living with HIV and the like. So um, challenges will be there, but it is our hope that with constant trainings, that persons who are coming into our facilities for treatment will find it more friendlier, will find it more comforting. They will look forth, to go to the clinic to access care. But I also want to add here that these challenges shouldn't keep anyone from going to the facility. Of course, you're going for your health, and there's this example I used to give. If I'm hungry and I need to go to the restaurant to eat, I will not say because of the poor attitude of the manager, of the supervisor, or the waiter, I will not go to eat. I will die of hunger. There are many places I can go to eat. So also in HIV treatment, there are many places you can go to access care. If you feel uncomfortable in any way at the facility where you're accessing care, go to another place. By all means, get in care, stay in care, continue treating HIV, continue suppressing it, keep it undetectable, because that's a successful treatment.
So, can you tell us this? The healthcare system there in Nigeria. how does it compare to the other countries around the world? Is it like a really strong, positive, forthcoming to where everything is accessible when it comes to healthcare, or is it behind in time?
I've not gone to all the countries of the world, but I must tell you this, that um, Nigeria is doing well when it comes to um, um, healthcare provision. Yes, they are doing well. I must say this. Um, People are accessing care. People are getting what they want. We might not be like the way it might be in America, but people go to hospital and we have trained healthcare professionals who are there to attend to our health needs.
Well, I want to say, see, that's a crucial issue to address, because just when you think about it, because you have there are some states here in the U.S. where accessing care is not as good as other states or cities. You know
Oh,
what I'm saying? So it's lacking in a lot of places. I mean, you can
okay,
say that it may be like the top the number one country in the world as they call it, but when it comes to healthcare there's a lot of problems because I
okay,
mean to access that kind of treatment, especially for those that are insurance challenged,
okay.
there's like an enormous amount of money that they have to pay. And so that's the reason why I was just asking that, is because I know that you guys are definitely, I know, one of the top countries in the world. And I also know that when it comes to just for especially for importing, exporting, I mean, it's like you guys are one of the leaders. And so that's
We
why I
are
asked the question, you
we are
know?
making progress. Yes. Um, for our healthcare system is not totally bad.
Hmm.
Progress is being made. But
Hmm.
again, you should know that once you come to a facility, a healthcare center, you will be attended to. And in the field of HIV, where is my immediate constituency, I must tell you that anybody who presents at the clinic will get the best of HIV care in Nigeria. The question is, are you willing to come in, you know, be it testing, be it treatment, be it prevention tools, you will get it. And they are free. They are absolutely free and easily accessible. And trainings are being done, periodically to train the healthcare providers, and they are delivering. We are not in 1920s,
Hmm.
for crying out loud. This 2024, and we are doing well.
Look, shifting gears to HIV prevention, what are some effective methods for preventing HIV transmission?
We have multiple options these days. Gone
Mhm,
are the days we have only condom. Now we have PrEP, right? And one thing I used to say is that you don't ask people about their HIV status. Just be on PrEP, right?
mhm.
PrEP has been found to be very, very effective in HIV prevention. So if you think that you are at high risk of HIV infection,
Mhm,
I suggest you be on PrEP. So for HIV prevention, PrEP is there. Condom is there to protect one from other STIs, including HIV. But if you rule out other STIs, PrEP is cool. Again, U equals U is another concept for HIV prevention. If someone is living with HIV on meds and achieve viral suppression, the person is absolutely at no risk of infecting another person through sex. So U equals U is there to give us prevention from HIV infection. It's just that we need to push this message, and we need to educate, enlighten people the more, remove stigma, and allow people who needs this treatment to come in, get treated, so that we will have fewer or zero new infection. So we have condom, we have PrEP, we have U equals seal, and they are effective tools for HIV prevention.
Thank you for highlighting those prevention strategies. Now let's talk about the stigma surrounding HIV. How does stigma impact individuals living with HIV?
Is Stigma is an enemy to the fight of HIV. Stigma is a barrier. Stigma is everything bad, right? It affects people, mentally, socially, physically. Um, just today, I met a young lady who had who tested positive for 2 years now, and she wasn't on treatment. Not until someone close to her contacted me. I spoke to the lady. Then she had to come to the clinic, and she told me the reason why she had delayed starting treatment. So stigma has been of barrier to the fight of HIV, and it affects people living with HIV greatly. You know, imagine when you are being talked about, that you are dying, you are worthless, you are people are running away from you. In a family, you have separate plates, you have separate cup, you have separate utensils, you have all these thing, you have separate room, nobody comes to you. Is as good as not living, right? So
Mhm.
I I fight stigma with everything in me to make sure that anybody close to me do not experience that. And even if you are not knowledgeable enough, I think you should get educated. For people who are stigmatizing, there are a lot of things to read, there are a lot of things to learn from. Get educated, and if you don't know what to say, if you don't know what to do, just keep quiet, because somebody might be listening. Your loved one might be living with HIV, and what you say might make the person to go into hiding. So stigma stop people from testing, stops people from treating, stop people from accessing prevention tools like PrEP, like condom. And when all these things are there to protect us, and but stigma is being there as a barrier, we will not make progress. We'll keep having new infections. And we think that it is far from us. We don't know that it is at the back of our house. So stigma is a barrier, great barrier.
Well, I'll tell you, it's definitely important to address and to combat HIV related stigma. But what can individuals and communities do to reduce stigma and support those living with HIV?
I would say that it is the issue of HIV management, HIV fighting, HIV is everybody's business. Everybody's business. And I strongly suggest that everybody should get involved in ensuring that we get rid of this disease. Like, if we put our hands together, put our voices together, speak against stigma, knowing that it can happen to a son, it can happen to a daughter, it can happen to a father, mother, grandfather, grandmother, niece, cousin. It can happen to anybody, your co-worker, your manager, your supervisor. If we have this mindset that stigma is both in the pew as well as in the palace, so we should get involved and speak against it. Religious leaders, community leaders, heads of organizations, influential people, um, uh, uh, celebrities, everybody voicing it out, making HIV look ordinary, making living with HIV look very simple. It will go a long way. You know, that we know that HIV is a common enemy that we should fight, not people living with HIV. So everybody should get involved because it concerns everybody.
So, what are the benefits of getting tested for HIV regularly?
Oh, so that you treat it on time. And
Mhm.
regularly, we mean here is if depending on the kind of sexual life one lives, you know, every 3 months is cool, every 6 months is fine, you know. Um, and I don't like there's this statement that is popular in Nigeria, especially on social media when we talk about HIV. I'm going to use pidgin English how they put it here. They said that thing where you define you will see am, right? That thing you're looking for, you will see it. Is not good. It's not a cool statement. So I strongly suggest that as far as you are sexually active, and because HIV testing is free, walk into the clinic maybe every 3 months. Is very beneficial every 6 months, so that once we see it on time, we start on time, we stop HIV on time.
Oh, I love that. I love that. Um, so when we just mentioned, well, just asking you that question about getting tested regularly, is there a such as how often individuals should get tested for HIV?
Individuals for persons who are same-sex lovers, I strongly suggest that you go to clinic maybe once in 6 months. That would be cool. Um, if you're not in a steady relationship, testing regularly also is very important. So just test, and it's free. It's free, basically. You don't need to pay here in Nigeria to pay. And also, we have this self-test kit is also free. I used to talk about it. And if you ever have challenges in accessing these testing tools, or you are being asked to pay in a government hospital or military hospitals, you're being asked, please talk to me, because nobody will collect a dime from you. So I encourage people, go out, get tested. Submit yourself, be bold enough to say, I am here for my HIV test, and nobody will walk you out, and nobody will talk down on you, because you are looking after your health. You are involved in your sexual health, and that is commendable.
Now, for the uneducated, can you tell us if HIV can be transmitted through casual contact?
It's very obvious. I don't know who is uneducated. Um, as far as you're listening to us this time, HIV is only transmitted through blood contact, through sex, sharing of sharp objects, maybe mother to child transmission, you know. But if it is treated to undetectable, there will be nothing to worry about. So HIV cannot be transmitted through kissing, cannot be transmitted through sharing restroom together, sharing eating objects, our cutleries, our plates and cups and spoons. HIV cannot be transmitted. HIV cannot be transmitted through mosquito bites. HIV cannot be transmitted by touching or by hugging, swimming together in the swimming pool. If these are not, if anything that is not, blood contact is not, HIV cannot be transmitted through such means. Yeah, there's nothing to worry about, basically. So all
You know,
these fears of I don't want to touch, I don't want to, shake hands. That's outdated, archaic uh, way of approaching HIV.
so what are the most common myths about HIV?
The most common, depending on the an individual, the most common is that um, there's one coming to mind now that once I have sex, I will go and take my bath, and I will not get infected. Or that having sex, Charles is funny. It's very funny when you hear these things. You people think sex with a virgin will prevent you from having HIV. That
Wow.
what other that it is spiritual, said, kind of. I'm not downgrading anybody's faith, but HIV is, and if it is that's once it's been treated, and one is on ARV, the risk, one is in doubt. There are a lot of materials, resources one can follow. Simply ask questions. Simply ask questions, and so that one will do better.
So, I think we mentioned this earlier, but I mean, if you could be a little bit more in depth with this answer,
Okay.
tell us, how has HIV treatment evolved over the years?
Sorry, I lost you.
I said, if you can, I think we mentioned this earlier, but if you could be a little bit more in depth, how has HIV treatment evolved over the years?
I didn't quite get the question because the it was
Okay. Oh, hold on.
okay. You were saying how has HIV treatment
Evolved over the years.
over the years? Okay.
Yes.
Um, Before now, you see that like I said earlier on, we are battling with a lot of adverse drug reactions when we are when we started earlier on. Apart from adverse drug reactions, we have multi drugs to take, pill burden to take. Um, you have drug interaction persons who are living with HIV conditions. So over the years, HIV treatments have greatly evolved. That today, um, people are more comfortable, less worrying in treating HIV. You have one pill to take, whether it's in the morning or at night. Um, you have zero drug interaction. You have you can now eat whatever you want to eat. Before now, you look at, oh, what am I going to eat so that it will not affect my drug and all that. So science have made it easier for us that treating HIV will no longer be a burden. Um, will no longer look like it's hard to. And if you interact with friends who are living with HIV, they will tell you that we have it better now than we had it 10 or 20 years uh, ago.
So, what are some of the side effects of HIV treatment?
Oh, depending on the kind of ARV one is on. So I would say is it does not have any particular side effect. Again, our bodies differ. What I experience might not be what you will be experiencing, but the bottom line is that as long as you're taking your drugs, please, and you noticed any discomfort, we strongly suggest that you talk to your healthcare provider. um, Let them know what you're feeling. Let them know how you're feeling. Explain to them. Everything will be sorted out. The side effect is normalized. So that's how I'll put it.
Okay. And did you mention that they're in Nigeria, that the treatments or the drugs are free, or do they have to pay anything at all?
You pay nothing. They are very free.
Stop the madness.
Are you surprised? I have some
Yes.
friends who are in your country who told me that, oh, we pay so amount of money for
Yeah.
ARV. I'll be like, oh. And I have some friends who left Nigeria and came over to your country who told me, oh, the one I came to the US with has finished. I'm now going to pay for this. And I'll be like, oh, I don't understand. I truly do not understand that aspect. But in Nigeria, testing is free,
Hmm.
treatment is also free. I mean, the ARV is free. Nobody pays for anything.
Wow. Well, I want you to know, like I said, those that are insurance challenged here in the US have to pay an enormous amount of money. I mean, an astronomical amount of money. And
Mm,
so, they're trying to make that change, but
that would be great.
I would definitely love to see it get to that point, to where you guys are, because I think we're the only country that pays all of this money, when it comes to healthcare, which is why the healthcare system is not really that great. But, some of that first technology that comes out always comes here first. So that's what makes it, as they say, a leading edge in technology. But you pay for that. And so, it's like that is just that's amazing because I mean, to the north of the border is pretty much is little to nothing, you know, and that's just amazing. I mean, of course, it's not like, oh, let's go get HIV because we can get drugs for free. But I'm just saying in general, that definitely that states a lot. It really does.
Yes, yes,
It
and
really
I'm happy
does.
too that imagine someone who is struggling to eat in a day, have 3 square meals in a day, and you walk into a clinic, the person is living with HIV, and you're requesting, asking the person to pay extra few naira to get these pills. It will be a burden. It will scare people away from accessing this care. And imagine when someone is not on treatment, the person will get sick and probably the person will die. So for the Nigerian government, and again, your country has been of great help. There's this partnership, US and Nigerian partnership in fact, the PEPFAR, in fighting HIV, providing healthcare for persons who are living with HIV. They've made, and on this note, I want to thank PEPFAR, the activities in Nigeria, specifically in ensuring good health, healthy living for persons living with HIV. And like I said, the ARV is very free, is absolutely free and accessible, easily accessible. The challenge is that if one will be courageous enough to walk into the facility. And despite, Charles, let me also surprise you, despite that this treatment is free, we still have people who buy them because they don't want to be seen in a facility. So because they have the means, they have the money, they prefer to buy. But I don't know how they get those drugs to buy. The one I know is that it is free in all um, government hospitals, military hospitals, faith-based hospitals, facilities for anyone to access.
So, how effective has PrEP been in preventing HIV transmission?
Very effective, 99% effective in preventing.
Really?
If yes, yes, read it up. And again, if one takes it as prescribed, if you're taking it haphazardly, and you think it will work, it will not work. Take it the way it is prescribed, religiously, consistently, regularly. You see that the one has nothing to worry about. So prep is there and is very effective, and I greatly, strongly suggest that persons who are at high risk of HIV infection, you know, get prep, be on prep, and one will have nothing to worry about.
So, can I ask you this? Have there been any barriers that people has faced when it comes to getting treatment? Have there been any barriers whatsoever that you know of?
In Nigeria, no barrier whatsoever, no
Mhm.
barrier whatsoever, because you know we want to see to the end of HIV. We want to see that as many as possible people who are living with HIV are placed on treatment. Nigerian government and organizations involved in giving out these services have made it quite easier for persons who are living with HIV to walk into the facility and access care. So there's no known barriers whatsoever. Once you walk in, you are attended to, irrespective, despite your sexual orientation or your gender or your beliefs. There's no barrier.
So, tell us, how can healthcare providers better support the individuals that are living with HIV?
Oh, I will I will suggest that we healthcare providers will be more apply more empathy, in discharging our duties, ensuring that these persons who come in are there to be attended to like every other person who comes to the clinic. If someone is diabetic or someone living with diabetes, somebody living with hypertension, who is hypertensive, can walk in and get healthcare services. The same thing, someone who is living with HIV, we should try to understand these persons the more understanding, more empathy, more love, more openness, access, so that when we open our doors and remove all these bottlenecks, in our facilities, we see people, being willing to come to treat HIV and equally bring in their partners and say, okay, please come. But when we create barriers, we build walls of hate, of hostility, and stigmatizing words or attitude. You see people running away from us, and it will be like merry-go-round. We are just going back to the 80s. So we should understand people the more. We should open our doors, remove the bottlenecks that is preventing people from coming to the facility. It will go a long way in the fight against HIV.
Oh, wow. So, what role do social determinants of health play in HIV prevention and treatment?
When you say social determinants, what do you mean?
Like, let's say, I'm talking about social determinants of the health. So, like, if you're like somebody that's not sick at all, do you like go to the front of the line? Or if you're like extremely sick, you go to the front of the line? Or, if um let's say if you have more money than someone else, do you get is it determinant that you're first and they're second? Are there any of those whatsoever?
There's nothing like that here. There's nothing like that. Moreover, if you have more money, you should go to places for people who have more money. So, or you get sick. But my the point is, I understand you. We have private hospitals. We have all this. We have government hospitals, and we attend to people based on their needs. If there is an emergency, of course, we have to save life first. We have to go to the A&E. But we don't do first discriminating because of social status. You are a senator, therefore come in. You are a cleaner, please go behind. No, that's not. It shouldn't be heard of in healthcare environment.
Wow. So how can we address HIV related stigma in healthcare settings?
Okay, in healthcare settings, you mean people who are the healthcare providers. So healthcare providers should know better, basically. They should know better. They should know that their 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 profession, there are ethics, in their profession. So if we are trying to educate people who don't know, what about people who know? People that should know. So stigma shouldn't be heard of in healthcare environment. You know, healthcare. I say facility, hospital, clinic, interchangeably. They should be a place of. It should serve like a fortress for people are who need this help. If I'm whole, if I'm healthy, I don't need to go to the clinic. But once I come to the hospital, you know, I need help. So I should get the help that I need. I shouldn't be I shouldn't be laden with more burden, when I come to the hospital. So healthcare providers should do better, make persons, whoever they are attending to feel safe and be assured that they are in safe hands. So, are there stigma in healthcare setting? Yes, but we are making progress. We are constant education, enlightenment, training, seminars. We'll get rid of all these things. Someone someone who is not doing it well, and you tell him or her that, oh, that's not the way to do it. You encourage, you educate, you see the person doing better. So we are making progress, basically.
So, what resources, if you tell our audience again, what resources are available for the individuals seeking HIV testing and treatment?
In Nigerian setting,
Yes,
uh,
yes.
again, this depends on it varies from treatment facility to treatment facility. You see some organizations or some centers coming up with some alleviating programs, maybe, you know other components of management, maybe for mental health or for economic alleviation. It varies, basically. But are there such things in treatment facilities? Yes. But I might not be able to mention that facility A does this, facility B does that. But there are things on ground to ensure that people who are accessing this care are not only coming for ARV, they come in for other things, for nutrition purposes, for mental health purposes, for relationship purposes. It just encompasses holistic management.
Okay, so let me ask you this question, and now this I may be a little naive here, so I'm asking, because I want to know this. Do you guys have what's called minority communities in Nigeria?
When you say minority communities, what do you mean?
Like where there, let's say in this case, if everything is sectioned off like poor people, rich people, or poor, middle class, rich, or black and white. Do you have minority communities?
we will not have black or white because everybody's black in Nigeria. So we have settings where you have low income earners, you have rural setting, you have urban settings. We have something like that.
Mhm. Okay,
Yes.
so there are no minority communities because, like here in the US, we do have minority communities. And
Oh,
so, yes, and so with that, with everything being sectioned off in that manner, and basically, you're stuck here, here, or here, you know, those are what we call underserved communities. And so in those underserved communities, a lot of those people either don't have health care or they're struggling to pay for health care. So basically, the best treatment does not go there. And so that's just that struggle is real. And that's the way it goes. And
and
so go
I'm
ahead.
listening.
Yeah.
I have problem with all these nomenclatures. You made mention of minority. Who determines who is a minor and who is a major?
Yes. That's what's considered black communities.
Oh, and you made mention of undeserved community,
Underserved. Underserved.
under underserved,
Yes, underserved, which
underserved.
means yes, which means from an economic perspective, where everybody's supposedly is supposed to be equal across the board is not equal. That's just spoken. That's just
Well,
spoken language.
I must tell you, Charles, that I am disappointed that in 2024, in 21st century, we are still talking about all these discrepancies,
But it's
and
real.
it's real. Um, but again, these are what made us to be where we are today in the fight against HIV. we were
Exactly.
think we were thinking that these I read a lot. I read what happens in your country when it comes to HIV. You hear black community, you hear Latino community, you hear this and that. Okay,
Yeah.
these the mistakes we made in the 1980s are being repeated, kind of, and it has been kind of modified, but it's still the mistake. Why not give them equal healthcare services because of the common enemy we are fighting against? If I quench this fire here in this underserved community, this fire in this underserved community will not encroach, permit me to use this word, served community.
That's not the point, but you're taxed and you pay your taxes like everybody else, but you don't have as much money as most people. So therefore, there's a tier system. There's a top and they go down in tiers. So the further down you are on that ring, it
The worse
deter-
it becomes, the
it
worse it is
determines.
for the person.
Yes, it's life or death is what it is.
Oh,
So primarily
very unfortunate.
that's the reason. That is the reason why this podcast has been created. And that's why it's called America in Black and White. And it's because those that are in the underserved communities, which is the target, they're the ones that need to benefit most from this conversation like what we're having now.
Oh,
Is
great.
because learning and knowing what resources are and you seeing the difference, especially when you see people that look like
Yeah,
what we want them to understand, or what I'm trying to get out to those communities, is
yeah,
that there's so many more ways of finding the resources that you need, but also in being strong and trying to do the best that you can and looking for those resources. We can help pull you up.
yeah,
That's the whole thing. So it's not about, oh, it's me and then it's you. This
yeah,
show is not about that. This show is about everybody that's supposed to be what we're all supposed to be, which is equal across the board. And so
exactly.
And so what we're trying to do, and the purpose of this show is I want to make sure that everybody that actually not only watch this show and know what the impact is supposed to be, but it's a learned experience, because what you're giving is knowledge, and this is the knowledge that people need to have. And
Yeah,
so in just learning, even though it's from abroad, it
yeah,
still means the same thing because the
yeah,
effects are the same.
yeah.
You see?
I, I will add here, Charles, that I will really really commend your efforts. I've seen not quite much, but little of your program, of what you're doing, and you're doing great. You're impacting lives. You're touching lives in a great way. So for people who look like me, who are black and beautiful, black and
Exactly.
bold, um, though we might be in different cities, different countries, but we are the same. We feel the same pulse. We are affected in the same way. We all get hurt, but we might react differently, but we all get hurt, right? For the black community, maybe they've gotten used to these names. I don't want to get used to these names of minority. They might be called minority group, but you are more than that. You're a human being like every other person, and don't allow the geography where you see
The
yourself,
status quo.
the locality where you see yourself, to limit you to think that all hope is lost. And no, all hope is not lost. And we have life to live, and we should get out there and live a full human life.
Yes, exactly. And I want to ask you this question next is how can we improve HIV education and awareness in schools?
Oh, I will use this term, catch them young, right? Our
Okay.
young ones, our children in schools, they should know about HIV, how it's being transmitted, and how it's being treated, and when it's treated, what it looks like, and other. When we start young to pass this message, early to pass this message, inculcate it in our, I'm happy is in some of our school curriculums, but I don't really know how encompassing, how depth, how deep it is. So, but it will go a long way if our educational system, include this HIV awareness in our schools. Teach these young ones that HIV is not a death sentence, and you don't know who you might be influencing. Teach these young ones that um, living with HIV doesn't make you different. And mind you, we have young people who are born with HIV, who got it from their mother. So these ones are growing up to be an adult. So we need to pass this message early, that you can grow up to be whatever you want to be, and still be living with HIV, and it will not limit you, right? So it's very important to that our educational system um, make HIV awareness a core thing, make it put it at the center of our activities in school, in whichever way, maybe forming clubs, or um, you know drawings or educational materials, just to ensure that this message is passed in plain words, so that the message is gotten, and everybody carry speaks the same thing, understands the same thing. In Nigeria, we are doing that, because I've seen young people, small children, that I'll ask them, okay, what do you know about HIV? Have they thought about this in school? They will tell you yes. They will tell you the level they know, and is encouraging. but we need to do more. We need to put more effort. And when we do that, we'll have not only lesser stigma, but zero stigma, in our society.
Right. So, do you have time for a few more questions?
Go ahead.
Okay, so tell us about the latest advancements in the HIV research and treatment that you have gotten a hold of to as of lately.
Okay. I will comment here many international organizations who are doing great work in HIV program like IAS, and in fact last year July, WHO gave out a policy brief, putting their weight behind you equals you, you know, stamping it that it is zero risk, when one is undetectable. So advancements are on and going on. There are a lot of things happening. The recent conference that was held that came up with a lot of research that that treatment is working. Um, Great researchers voicing out and putting their weight behind these fights, making it, giving it a human face, and is kind of encouraging that the work we are doing, or we are rendering, the services we are rendering, is really effective, and the people who needs to hear this are getting the message. So, and again, I people have been asking, and I know a lot of people wants to know, when is the cure coming? We might not know when the cure will come, but the treatment, like I tell people, the treatment we have is very effective to keep us alive until and if the cure comes. And another advancement we are having, I think in your country, US, it has been kicked off. We are now moving away from pill to injectable ARV, right? So you see that before now we are swallowing, and now we are going to take some few shots for some period of time. So what I would tell people, my friends who are living with HIV, is that one should be hopeful, full of hope. We are not stagnant. From the 80s, we are making progress, and see where we are today. From pill body, see where we are today, one pill, and we are making progress to injectable ARV, injectable PrEP, and others. So a whole lot of things are happening, and it gets better.
Okay. Now I'm gonna preface this before I ask you this question. I just want everyone to know, for disclosure, that I am a spiritual individual. I am not religious. I am spiritual.
That's beautiful.
And so what I want to know is if you can tell me, how can these faith-based organizations support HIV prevention and treatment efforts?
Oh, their input is highly needed. The pastors, the imams, whatever, the rabbis, whatever religious beliefs anybody is following, you know, religion plays key role in advancing whatever progress we want to make, because the followers of these religious organizations tends to have enormous respect to the religious leaders and heads. So we also want these heads of religious bodies to also understand that yes, God heals, God answers prayers, and the same God that gave men and women, the scientists, the researchers, the wisdom to give us what we have today. So Is a miracle, is a prayer answered. What if HIV is not treatable? What if HIV is not preventable? You know, yes, let's pray, let's fast, let's call on God, but also encourage our followers, our followers, that this treatment is very, very effective in stopping the damages HIV can do to the body, to the society. So our religious bodies are very vital. They are needed. They are key in the fight against HIV. We can't do without them because we have people who are under them who listen to them. You know. And for we
So,
to get to them, we also need to use them to get to them.
so what are the key components of a comprehensive HIV prevention strategy?
There are many key components. Every component is vital. You know, is as important um, as the other. Okay, testing is there. You know, prep is there. Um, early treatment is there. Staying in care, you know, like we said, getting U equals U is not a one-off thing. I've achieved undetectable viral load. I am now untransmittable. Therefore, I will stop taking my pills. No, continue taking your pills. So stay in care. Don't fall out of care. Don't stop going for your clinic appointment. So these are more are components in HIV management. So we test early, we detect early, we diagnose early, we treat early, we continue treating and don't stop treating. We continue taking the pills every day, whether it's injectable. We meet up our appointment to take the injection or pills. If you are yet to get the injectable, we keep going for our clinics and we keep visiting the doctor. We keep opening up. These are components, and it's not only for an individual. When you get an individual, this individual they have people in the society. So you get an individual, the society will be healthy as well.
Okay, and our final question for you: how can individuals advocate for HIV awareness and prevention in their communities?
Like I said earlier on, is everybody's concern. You must not wait to be living with HIV. You must not be living with HIV for you to talk about HIV. You know, is everybody's concern. It's everybody's business. Black, white, tall, short. You know, um, African. Uh, you are from Latin, all that. Everybody should be involved in the fight against HIV. Because if you keep quiet and say it doesn't concern me, it's not my business, it's for them. That was the attitude of the 80s, and see where we are today. Everybody is, getting more people are getting infected. So individuals, wherever you are, no matter your social status, wherever you are in the spectrum, lend your voice, use your social media handles. You must not have advanced knowledge about HIV. You can just, post it, tweet it, and say treatment works, get tested, get treated, stay in care, walk into facility today and check your HIV status. If you test positive, please start treatment on time. Those little posts we make will go a long way because we have followers, we have people who are following us, our friends on social media who might benefit from these messages. So everybody should get involved, and that's how to fight a common enemy.
Well, I want to thank you for answering all those questions, Ugo. Your expertise and insights have been invaluable. But before we wrap up, is there anything else you'd like to share with our listeners?
Oh, I would say that everybody is important, and for persons who are living with HIV, this is me encouraging you to keep thriving and keep living. You're a human being, you are valuable, you are precious, and with treatment, you can live the kind of life you want to live. And for persons who are not living with HIV, I also want to encourage that you get tested, keep getting tested, get prevention tools, maybe using condom or PrEP or something, so that we will have lesser people to manage, and let's love more, let's understand better, and listen to understand, and see that everybody is equal. We are all equal. We are all human beings, and nobody is bigger or lesser. And
Ugo, are you still there? Ugo, are you still there? Well, ladies and gentlemen, you just got a show that was broadcasted live from Nigeria over in Africa. And we want to thank Ugo for doing a wonderful job of telling us of the situation with HIV in his country of Nigeria. I want to thank you. I want to thank Ugo for joining us today, and our listeners, of course. And thank you for tuning in to America in Black and White. Stay informed, stay engaged, and stay united. Until next time, take care, and we